Welcome to the heart of rural India, where a transformative healthcare revolution is taking shape. Join us as we unveil an inspiring journey that's changing lives through innovative partnerships and advanced technology. Our dedicated ASHA worker, equipped with the P2 screening device, her gateway to a seamless process of support. Today, ASHA worker will embark on a transformative journey with beneficiaries. It all begins with the authentication of Aadhaar ID and creation of Aabha ID. The Aabha ID, a key to personalized care, is created by our trusted partner, Sign-Z, the guardian of identities, ensures beneficiaries' Aabha ID is secure, paving the way for a connected experience. With the ID verified, ASHA worker assists beneficiaries in completing clinical screening and health risk assessment using a trusted partner, Elsevier's award-winning screening and health risk assessment platform. The results, vital health insights are carefully gathered and seamlessly uploaded to the state database. ASHA worker also uses the Nadi Pulse prognostics from our P7 partner. Using the wristband Nadi Pulse device, ASHA worker monitors beneficiaries' pulse. The vital data generated as output from this device is sent to the state database. Enter Health SmartTech, a P4 partner, analyzing the data. Expert doctors review the insights and prescribing tests tailored to the beneficiary's needs. The doctor's recommendations are uploaded to the state database. Our P3 partner, eHealth system, springs to action. The prescribed tests are conducted efficiently at the PHCs. The test outcomes are transmitted to the state database, forming a crucial link in the chain of care. The test results are available for P4 Health SmartTech to check the result of the test. Doctors then consult the beneficiary if test results suggest a medical intervention. Doctors at the PHC will then consult the beneficiary and prescribe necessary medicines. The prescription is uploaded to the state database. Murli Krishna Pharma, our trusted P5 partner, is our provider of the specialized liposomal oil. P5 keeps the PHC pharmacy stocked with this oil and replenishes the stock based on the projections derived from the prescription data. Medicine availability at PHC is uploaded to the state database. Similarly, the P6 partner, Koe Pharmaceuticals, is a provider of medicines for diabetes and hypertension. P6 keeps the PHC pharmacy stocked with these medicines and replenishes the stock based on the projections derived from the prescription data. Medicine availability at PHC is uploaded to the state database. Yugasa Bot, our P8 partner, empowers ASHA workers through training and support, performance evaluations and content delivery to streamline their journey. The evaluation report is uploaded to the state database. The Ease of Doing Business, a pilot project agency, our P9 partner, leverages data analytics, enabling smarter decisions, track beneficiary progress, and ensuring partner success. It is also responsible for onboarding of the partners. The data is again uploaded to the state database. Lastly, Innoplexis, our P10 partner, transforms data into insights. From processing to indexing, a wealth of knowledge emerges, guiding healthcare strategies. They will handle technology and marketing services, along with that negotiate with users to financially support DIISHA on an annuity model. A symphony of partners, each playing a vital role, together weaving a tapestry of care, trust and progress. From homes to hearts, from data to insights, we are reshaping healthcare, nurturing lives, one step at a time. Together we transform, together we heal.